Hi, my name is Kelsey Ortmann. I'm a nurse practitioner student through Maryville University. This is my patient today, Tammy. She's a 58-year-old female and she has offered to be my patient. We have already completed our introductions. We have also completed the Snellen chart and the Rosenbaum chart, which she scored a 20 out of 20 in each eye on both charts, which are normal findings. If you would go ahead and close one of your eyes and keep focus on my nose and tell me what number you see, okay?
2, 1.
All right, go ahead and put your hand over the other eye. No. Cliff.
2, 1.
All right, very good. No abnormal findings. I'm going to go ahead and now take a look at her eyebrows. They are blonde. They extend into the external canthus. There is no flakiness. I note no lesions. There's no tenderness, no nodules. I'm going to now look at her orbital walls. There are no redundant tissues, no nodules, no lesions. If I could go ahead and get you to open and close your eyes for me. Very good. I don't see any tremor, no shakiness, no ptosis. There's no redness or swelling. I don't see any discharge. There's no tenderness on palpation. I don't note any nodules. Okay. Her corneas are clear in both eyes. Her iris are blue. I'm going to go ahead and shine a light in your eye here real quick to test for pupil reaction. Right now, for the light, her pupils are equal in size. Quick light. Both eyes respond equally to the light. They're both reactive, round. There is no sensitivity to the light. Her lacrimal glands are pink on both sides. There's no redness or irritation, no itching, no swelling, no discharge. Okay, now I'm just going to have you, I'm going to move the pen light towards your nose. Just follow it with your eyes, okay? Very good. There was no tremor, no nystagmus, no abnormal movements from her eyes. I'm now going to test your extraocular movements, extraocular muscle movements. Corneas are both reactive on both sides. If I could go ahead and have you cover one eye and look straight at my nose. Very good. Now switch. Very good. There was no abnormal movements, no shaking, no tremors in either eye, which are normal findings. Now I'm going to have you look straight ahead at my face and just follow my finger with your eyes, okay? Very good. Okay, now I'm going to go ahead and just look inside your eyes, okay?
Okay.
Her sclera is white in both eyes. Her conjunctiva is pink. Both of those are normal findings. There's no discharge. I don't note any redness or swelling in either eye. Are there any pain or tenderness in your eyes?
No.
No, those are all normal findings. Okay, so we'll move into your ear exam. So I note on both sides her ears are symmetric. They are equal in shape. They're pink. There are no lesions, no flakiness. I don't palpate any lesions or swelling. They are symmetrical on both sides and in line with her eyes. I'm now going to take my ophthalmoscope and go ahead and do an exam of your eyes. Just go ahead and stay very relaxed. Her lens is clear in this eye. I see her retina is orange. Also clear in this eye, and her retina is orange. I note the red reflex in both eyes. I can also see her blood vessels are within normal limits. There is no bulging. There doesn't appear to be any damage or extra redness or anything like that. I can see the outline of her optic disc in both eyes. It is orange, which is a normal finding. I can also see her macula, which is yellow, which is also a normal finding. I can also note the depth of her anterior chamber, which is about 3 millimeters, which is also a normal finding. And now we will go ahead and move on to your ear exam. So we'll move into your ear exam. So I note on both sides her ears are symmetric. They are equal in shape. They are pink. There are no lesions, no flakiness. I don't palpate any lesions or swelling. They are symmetrical on both sides and in line with her eyes. I'm next going to grab my otoscope and take a look inside of your ears here. There is a little bit of cerumen, but I can see the tympanic membrane. It is pearly gray. I do not see any perforations or abnormalities. There is no redness or swelling over here, which are all normal findings. I can also see the bony prominences landmarks. There's also a little bit of cerumen on this side, but I can see the tympanic membrane again. The bony prominences are intact. There is no perforation. Her tympanic membrane is pearly gray on this side as well, with no redness or swelling, no drainage or anything like that. The patient's hearing has been intact the entire exam. She has been able to answer questions appropriately and follow. She has not had any issues with hearing during the assessment, which is a normal finding. We are now going to complete the Weber test. I'm going to strike this and put it in the center of your head. If you could tell me if you hear it equally in both ears.
Yes.
Okay, and that is a normal finding. We are now going to test for... Okay, and now we are going to complete the Rennie test. Just let me know when you stop hearing it, and then we'll move it, and then let me know again when you stop hearing it again, okay?
Okay. Stop. Stop.
Okay, very good. Now we'll do this here.
Stop. Stop.
Okay, very good. She had normal findings. Her air conduction was 2 times longer than her bone conduction, which are both normal findings. And now we're going to complete the whisper test. I'm going to tell you 3 words. Just repeat them back to me. Blue dog 3.
Blue dog 3.
Very good. I'm going to do it on this side. Red cat 1.
Red cat 1.
Perfect. Very good. No abnormal findings on that either. Okay, next we will move to examine your nose. Her nose is equal and symmetric in shape. It is pink. There is no lesions or redness or swelling. There's no tenderness or nodules. I don't feel any bone deformity or breaks or anything like that. And now if I could go ahead and have you close one nostril and breathe in. Go ahead and do same on the other side. Both nostrils are patent on both sides, which is a normal finding. Okay, now I'm going to take a look inside of your nose. The nasal mucosa is pink and moist. I don't notice any drainage or redness or swelling. Her nasal turbinates project into her nasal passage, which is a normal finding. I don't note any deformities or anything like that. And now I am going to go ahead and palpate your sinuses. Let me know if you feel any pain or tenderness. I don't feel any swelling or notice any pain or tenderness in her frontal sinuses. There's also no swelling, pain, or tenderness in her maxillary sinus. Okay, now if you could go ahead and open your mouth. Her oral mucosa is pink and moist. Go ahead and stick your tongue out for me. Her tongue is also pink and moist. No redness or swelling or irritation. Let's see your teeth. I don't see any missing teeth, no obvious caries, no loose teeth, no abnormalities inside of her mouth. Okay. Let me see your gums. Open real wide. Her gums are pink and moist. I don't see any redness, no ulcerations, no bleeding or irritation. Okay, and now I'm gonna go ahead and test for your cranial nerves. Okay, if I could go ahead and have you stick out your tongue for me, move it from side to side, stick it in and out. Say la 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 for me.
La la la.
Okay, go ahead and open your mouth again for me. Stick your tongue out. Her uvula is pink and moist. There's no redness or swelling, no obvious infection or anything. Her tonsils are not present, which she already has told me in her health assessment that she has had a tonsillectomy. Her posterior pharynx is pink and moist, no redness, swelling, no tenderness or irritation. Okay, if I could go ahead and have you stick out your tongue for me, move it from side to side, stick it in and out. Say la 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 for me.
La la la.
Okay, go ahead and open your mouth again for me. Stick your tongue out. Her uvula is pink and moist. There's no redness or swelling, no obvious infection or anything. Her tonsils are not present, which she already has told me in her health assessment that she has had a tonsillectomy. Her posterior pharynx is pink and moist, no redness, swelling, no tenderness or irritation. Okay, and now I'm just going to go ahead and test for a gag reflex. Open up. And her gag reflex is intact, which is a normal finding. Thank you.